Approximately 68 million people who live in the United States speak predominantly a language other than English. Of those 68 million, 8% of them have a very poor comprehension of the English language. BrightSpring Health Services believes that it is important for every person we serve to be able to access the vital services and information they need for their health and well-being. The Patient Protection and Affordable Care Act is the comprehensive health care reform law enacted in March of 2010. Section 1557 of that law prohibits discrimination on the grounds of race, color, national origin, sex, age, or disability in health programs and activities. Also included in this section are steps that healthcare companies must take to ensure every individual served is provided the proper assistance so that language barriers do not prevent individuals from obtaining necessary health services and care. In compliance with this law and other federal civil rights laws, our company will provide language assistance services for individuals with limited English proficiency or those who require modifications due to disabilities to ensure meaningful access to our programs, activities, services, and other benefits. In addition, our company provides qualified American Sign Language interpreters, video interpreting services, and information in alternate formats for those with hearing and visual disabilities. Our company has partnered with Language Line Solutions in order to provide those needed translation services. This company is available 24 hours a day and can be accessed from your phone, laptop, or tablet. For all of our always caring operations, any use of Language Line for translation and production of any printed material or documents must first be approved by an executive director. There are tools provided by Language Line Solutions that give step-by-step instructions on how to access their services utilizing various mobile devices. These tools are available free of charge and should be ordered and available in each operation. Now let's discuss best practices for you to follow when there is a need for translation or interpreter services. Family members or friends of a patient should not be used as interpreters unless specifically requested by the individual and only after the patient has understood that an interpreter is available to them at no charge. This communication should be clearly documented in the patient's medical record. If the patient chooses to use a family member or friend as an interpreter, issues of competency, confidentiality, privacy, and conflict of interest should be considered before proceeding by the agency or operational leader. If the family member or friend is not competent or appropriate for any of these reasons, competent interpreter services will be provided for the patient. Children should not be used to interpret to ensure confidentiality of information and accurate communication. If a patient or employee believes that BrightSpring has failed to provide these services or has been discriminated against in any other way, such as the basis of race, color, national origin, age, disability, or sex, a grievance can be filed via mail, email, or by calling our compliance action line. Our Chief Compliance Officer, Rachel Kurzer-Givens, serves as our Section 1557 coordinator. The coordinator oversees the thorough investigation of the complaint and will take steps to preserve the confidentiality of files and records related to any grievances made. Each operation will have a specific client ID code provided by Language Line Solutions. This ID code and the operations location code will be needed when calling for interpreter assistance. Those can be obtained from your direct supervisor or operation manager. A civil rights complaint can also be filed with the U.S. Department of Health and Human Services, Office for Civil Rights, through the contact information listed here. This can also be filed by phone, mail, or email. Our company has developed a Notice of Availability for Language Assistance Services. This notice is compiled of the 15 languages most commonly spoken by individuals with limited English proficiency in our locations. It should be posted in clear and prominent places in our physical locations where it is reasonable for patients to see. The notice should also be provided to our patients annually and upon request. It is important to note that these notices and postings are for patient and caregiver use only. The materials are not to be utilized for any marketing purposes. The notice of availability is also required to be contained in various other written and electronic communications across the company. Examples include application and intake forms, any notices of denial or termination of eligibility, benefits, or services, notices of appeal and grievance rights, complaint forms, patient handbooks, and discharge paperwork. We are also required to include this information on our public-facing websites across all our lines of businesses. Our policies are required to contain a specific non-discrimination verbiage regarding availability of language assistance services. They must also contain the process or procedure for obtaining language or communication assistance when those we serve require those services. They should outline the procedure to make reasonable modifications in the future to avoid any discrimination. And finally, the procedures for filing a grievance are required within them. All of the reference policies, tools, and information regarding these new requirements can be found under the Compliance page, located on REACH. If you have questions regarding these requirements or with requesting assistance with translation services, please reach out to your direct manager or supervisor, your compliance representative, or your HR team member. Thank you for your time to learn about these new requirements and your hard work in providing the best and most compliant care for those we are privileged to serve.